Hello, guys. Welcome to the Body Contouring Podcast. My name is Anya Botero, aka the Queen of Eyes. And today I'm really excited because we're going to be talking about body contouring and post-op care. And I invited Tanisha Hicks. She is a professional in the beauty industry. We actually met when she was a student. She was getting her master's esthetician license. Eventually, she got interest in body contouring, and that's how we met. She started traveling with the company to international conventions, and now she's an expert on body contouring and post-op care. And so we're going to be learning and talking and meeting Tanisha. You guys, well, I already met her, but you will meet her and just learn and talk about this fun topic that the state doesn't understand, and I want to go there.
I don't even know if it's just the state. I wonder if people understand it too. Also, you're so kind to give me such wonderful introduction. But no, my name is Tanisha Hicks. My background is in medical. I'm a certified medical assistant. I've been doing that for home health and hospice for 17 years. Then I feel like I tripped into body sculpting, right? And then I just fell in love with it. And I got to meet you and learn about sculpt eyes and the wood therapy and then the different cultures behind it, because it's not just a beauty service. I think it's a little bit more of like an actual culture thing. And now here I am. I am one of Utah's, I think, biggest post-surgical care providing clinic spa. As like I said, I'm clinic driven because, oh my God, I'm clinic driven because we are very medical in our background. We're not just massage therapists helping people, but we're a spa because we don't want you to come in here and feel like, oh, bright lights, I'm back in the medical, it's my post-op at the doctor's office. We want it to be comfortable.
And this is why I was like, if I'm going to be talking about post-op care, the only person I can invite to talk about it is definitely Tanisha, because there is a lot of misconception and not a full understanding of what is post-op,
right,
why it's important after surgery. And so I wanted to talk to you and just ask you your point of view regarding this, because there's a lot of people that are going to be watching this episode that they're already into body contouring or they want to get into body contouring and post-op care, and just understanding that it's a serious topic.
It's a very serious topic. And it's not just with body contouring, even with how you teach it, you have to be mindful of what happens on top of the skin and under the skin. And then when you go into post-op, because a lot of it we think of as plastic surgery, but there's people, you're going to put your name as post-op. People have surgeries for birth. That's also a post-op. So there's sewing that happens if you have a natural birth or a C-section, orthopedic surgeries. And then with cosmetic surgeries, there's such a constant changing next big thing kind of, I don't want to say viral, but even trends in surgery, that if you don't keep up with that and you're not willing to learn the medical aspect of it and you're taking on these vulnerable people, you're just going to be left behind. So you've got to know medical as well as beauty when it comes to post-op.
Definitely. And what do you think, why do you think it's so critical to receive post-op care after a cosmetic surgery? Because there's a lot of people that invest $20,000 on surgery and then they're like, okay, that's it. I should be looking great after this. But after surgery, there is this need of post-op care. And so why do you think it's critical? And based on your experience, what do you notice between clients that they get cosmetic surgery and then they decide not to go on with post-op care?
Well, I always make the joke, you're not going to buy your dream luxury car and then all of a sudden put unleaded in it.
Yeah.
Or not change the oil or get the tires rotated or go to a back alley mechanic to have your favorite rims put on it. You're going to want to take care of your investment. Our body is the vehicle of life. And I think there's a lot of biases towards people who choose cosmetic surgeries because it is a luxury. But post-op care is the continuation of ensuring your luxury that you sacrifice for the money, because it's not very few insurances will cover that, and if they do cover it, it's not pretty. So you want to make sure that you're not only vetting the right surgeon for what your goals are, but you're ensuring that you have the quality of care to help you recover, because it might take a year for those who have extreme weight loss surgeries and then have cosmetic skin removal surgeries after that, it might take several years because of scar tissue, the way your body heals. So it's critical to not only vet the surgeon so you don't come out looking like who did it and what for, but have a care team that takes you the recovery, which is that post-op, which is it's just a few days if you really think about it. And then how to enhance your dream body afterwards. What's going to help you build that routine so you don't have to have that buyer's remorse, which is something a lot of people who don't get post-op care or invest in it, they have that.
I don't think if I ever told you, but after I had my third baby, I was told I was planning on changing my breast implants. And then I was told that I have a diastasis. So I'm like, what is that? Like, I had no idea. So they tell me you have to get a tummy tuck. I'm like, I have no extra skin to pull it. And they're like, a tummy tuck is more of a repair of your muscle, abdomen wall. And so I got it done and I was miserable like for 2 months because I was not very into post-op care. I didn't know anyone back then. This is 2015 or 16. It was after hers. It was 16.
Yeah.
And so it was
so crazy that our babies are now 8 years old.
Right. She's already 8. And I got it done and I was miserable. I'm telling you, I was like, I had no one to guide me. I think as a client, I made a lot of mistakes. And sometimes when we don't educate our clients, okay, you get your post-op care, you go home, you wear your faja, like this is what you're supposed to be eating, like all these things.
Like a friend, but also an accountability partner.
Yes, like it was, I was crying literally like every day, just thinking this is the worst thing that I have ever done to my body.
But what hit you for that? Was it your pain or was it like my
pain, because I had no one helping me. I mean, it was very minimal, the help that I got. And also I didn't felt like my body was processing that pain correctly. And because it was more something internal, I had a big diastasis. So it took me a while to fix it. So I did a lot of mistakes in my recovery process. Now that I have more information, what do you think are the most common mistakes that clients do after surgery?
They are so monolithic when it comes to after surgery. I feel like the most common is they don't plan their time for their recovery. And I feel like sometimes that can be based off of the clients or the patient's literal lack of knowledge. I think sometimes when you hear someone say their ignorance, you're like, oh, she's calling me ignorant. She's being, it's like, no, you don't know what you don't know.
You don't have to know as a client. Like you could just go and get a surgery.
Right.
And you're expecting your doctor.
Or you're looking at these before and after results, not knowing that they may or may not be years apart, or so
you know what, I actually was telling my client, like when you see a video of someone getting a liposuction, doctors put the before and then the after right away. Now every time I see that, I'm like, yeah, in a couple hours
on the table,
she's gonna on the table, she's gonna be couple hours, couple days later. That's when your body actually gets to react.
Your inflammatory response hits within those first 48 hours.
All
and that's why I
bruises.
always tell my girls, your surgery, that's not day 1. That's day 0.
Yeah,
that is when the
0.
bomb goes off. That is when your body is going through the trauma, because surgery is a controlled trauma to create a result. But the third thing, too, that I feel like a lot of people, well, the second one is they go by what they see versus what their body actually does with recovery. We've all experienced an injury. If you haven't, I need your good luck charm. Okay, because if you've never been sick, you've never been cut, had any issues like that, then we need to talk. But I often say, when you have an injury, you need to take the time to do that healing. And I'm not going to heal like you because my skin's different, my lifestyle's different, my heritage is different. I have a pre-existing age is different, and I have a pre-existing medical condition. So when I go to look at doctors, I don't know that person's background. 1, HIPAA. 2, that's not what they're selling you. They're not selling that person's background. They're selling you results.
Right.
So they don't do their due diligence in vetting the time, because a lot of people want to be cheap in the process, because there are consultation fees when you are meeting these professionals that are going to be taking your body and traumatically reconstructing it so that way you can have your evolution. And the last part of it is the clients are just microwave society. I'm going to get this surgery and then boom, I'm going to be great.
Yeah, no.
It doesn't work like that.
It doesn't work like that at all. I mean, by experience, I know that, and it was very hard for me. Now, for example, now if there, let's say you get a client and she's like, Tanisha, this is what I want to get done. Like I'm gonna get like a mommy makeover. What will be your pre-recommendations, like before I go into surgery, as a expertise on this topic, what will be the recommendations you give your clients before cosmetic surgery?
Well, I even ask them, what is a mommy makeover for you? What does that mean? Because when you were told about the tummy tuck, you instantly went to skin. And I think that's because of the culture around cosmetic surgery. But I'd be like, okay, what does a mommy makeover mean? Oh, I'm going to get my breasts done and my dice repair and my skin removed.
Yeah.
Okay, you're going to want to make sure you are in a very comfortable place. What time of year? Because we're in Utah, we have climates. I say we have 5 seasons: summer, winter, spring, fall, and construction. So if your surgeon is in the north part of the valley and you have a 45-minute car ride home, you have to think you're going to be feeling all of those bumps and dips.
Oh, yeah.
So I ask them, first of all, what does that mean? And it's if they do want the standard Utah mommy makeover, which is often breast work, stomach work with skin removal and a bit of lipo, then where are you going to sleep? Because you can't sleep flat. That just doesn't work. Who's going to be your support system?
I have clients that their husband built chairs for them.
Whole situations. And those husbands need gold medals, and you need to make sure that they get a really good Christmas gift the next year. And then too, I've even started having pre-surgical consultations where I invite the partner of the person having the surgery and like, hey, let's just look at it. And it's a part of their package. And like, okay, well, what are your questions? You're going to be picking this person up. What kind of questions should I ask the discharge?
They're going to be helping with the drainage.
And they're like, I don't know what to do. Is she bleeding to death? What's going on? And it's just like, I understand. And in a lot of cases, especially because we have a lot of mom and dad partnerships here, the husband's like, I can't fix this. I don't know what to do. Is she hemorrhaging to death? What is all this leakage? And
definitely you need someone that will help you.
Exactly.
Definitely.
But help you where you're at, not help you where they think, because once again, they don't know what's happening underneath all the bandages, the surgical
I feel compression. Like all women, we go like, yeah, let's go and get a mommy makeover. And we don't realize that this will be a big trauma in our body and that, we're going to be in bed for a couple weeks.
And if you're goers and you can't sit still, that's going to be the hardest part. Because if you're the matron of the family, I'm the one that does this, I do that, I cook, I clean, and get all this stuff. You're not going to be able to really fully, whether you choose post-op care specialty or not, truly and fully, 2 weeks, you're going to sit there. And then let's talk about not only the physical, but what about the mental? Not being able to get really in there.
Hard. When I got that diastasis, I was crying the whole time. I was just regretting myself, asking God for forgiveness at this point. It was so painful. I swear it was more painful than even pushing 3 babies. And it was very emotional.
3 babies.
Yeah, 3 babies.
3 babies.
And it was
she looks this amazing.
It was very emotional.
Lifestyle matters.
It was very emotional, Tanisha. I'm not going to lie. Like my sister saw me and she wanted to get her diastasis fixed.
And she changed
And she was like, I don't think I can do it. Like just looking at you right now, it's so hard. But I wish I had better information back then. I didn't. I started learning about post-op, I think maybe in 2019.
Gotcha.
And so I didn't know better about that. But another topic that I'm always concerned with body contouring is the protocols that professionals are following. When I started learning about post-op care, not body contouring, post-op care, I saw and talking to different people didn't know exactly, and I'm talking about the professional, if cavitation or ultrasound, which one was the good one to use after post-op care immediately. And I realized that not a lot of them understood the difference between cavitation and ultrasound.
Or they have these companies because there's ultrasound cavitation. So they don't even know what the difference is that in the machine. They don't know the vernacular about it. So they are I feel like the product of an industry that always wants to come out with the latest and the greatest and be the first and the unique, the viral, the one-stop shop. But if you don't even know fundamentals of healing, how are you even going to know what machines are?
And I mean, what is it? And I wanted to ask you, what is the protocol that you use when you take care of a post-op client? What is it like? Because, for example, what I know, it will be like lymphatic drainage, ultrasound. Some people get to clean the client depending on what type of surgery. So, Tanisha, so what is the most common protocol you do when we are doing post-op care? A lot of specialists, I've noticed, they don't know the difference between ultrasound and cavitation. So it's important to understand that there is a difference between those two. And so what is the recommended protocol or the safest protocol that you think you can get?
And also to when to use those things, because I think, once again, we're in an industry, especially because a lot of post-op is now infiltrating more where it used to be medicine. Like there was a medical thing, PACU, post-anesthesia care, unit. Now we're getting more into body and contouring, and the lines are getting blurred.
Yeah.
So I often say people need to know even what it means to heal a wound or what wound healing entails before they even know machines. Because there's a lot of people that incorporate machines super early on. So for my protocols is like, how can we get the client self-aware?
Yeah.
So in the office, because I have 2 streams, sometimes we'll go and do home, because like home health and hospice was my main thing. And then we have our spa clinic. So the first thing we do in the spa, because I want to focus on that, because that's where a lot of people are going to find them. Not a lot of people are going to want to do house calls.
Yeah.
It is a lot of work it's hard on the body, and it's just what it is. It's not pretty. It's beauty industry. Sorry, it's not pretty. But in the spa clinic, get the client comfortable. We get them in there. We often check their vitals first, especially if they're in that first week. We like to check their vitals, see their blood pressure. How is that? Because we're medically trained first, beauty trained as secondary. And if there's certain things that go either way, especially we do work with some really amazing local surgeons as well as national and international. We'll be like, hey, Anya came in, her blood pressure was 160/78. How would you like me to address her pain response? Because I'm educated for that.
That's good.
So as a client, find somebody that is going to understand pain. So get in there, get you comfortable.
And that has the education and preparation. Like you just don't want to go to anyone because horrible things can happen during that process. And I have heard horror stories, believe me, about things that might happen after post-op care. So,
and even then, even just getting care, because sometimes it's bare minimums that people are getting out of these post-op care facilities, and clients don't feel attended to.
Yeah.
So find a facility that's going to get you, because once again, post-op is days.
Yeah.
Post-op is literally, that is post the operation in regards to like how your body is,
at
inflammatory, bruising, at least 2 weeks.
At least 2
They
weeks.
say, and it depends on your healing factor, 7 to 14 days. And then after that, you get into indoor, which is like, what is going to be your muscles reaction, especially for those repairs. A lot of mommies don't even realize your back is going to be affected once you close that gap.
That's when I realized there was something going on, because my back was killing me. And they're like, you have a diastasis. I'm like, what is that? And then I have the video when they opened me. And it was pretty big.
Pretty sizable. Yeah. And then afterwards too, now you have a different type of back pain.
And I couldn't breathe.
There's no relaxing, because now you have an internal corset. Luckily you're a fashionista, so it was fine. But you had an internal corset.
If I had to do it all over again, I don't think I will do it. If you want me to be honest. It was so painful. I mean, it wasn't a cosmetic situation for me. Yeah. It was just something
yours was more medical necessity to give you that core back. But then too,
and I was very frustrated, because I was like, you're just like, I pushed 3 babies in a normal way. So I didn't have any scar. And then for me going through that, and then it was so much painful, the inflammation, I got constipated. It was very hard with the drainage situation. It was just a lot for me to process, and I have never gone through that.
And nobody really, and that's what I'm learning in some of these like local doctors, you either get a lot of information, which then scares the client. Cause like, oh my God, I'm going to die.
Yeah.
Or you get bare minimum. So even as the surgeon or whoever's doing the intake, taking that time to get to know the patient and what they like. And if they want more information, having you can go back to it, readdressed information. So if they're like, okay, tell me the bare minimums, but I would love that you had like an encyclopedia day surgery of your post-op, like your facility. So then when I'm feeling brave enough, because I get clients, oh, I didn't look it up. Why is this happening? I'm like, I get it. You don't want to psych yourself up because you've already taken days, months, years, decades to come to this decision that I want to have this life-changing. But for patients, once we get them into the room and we address their pain, then we start the therapy. And depending on the patient, if they're super alert, absolutely, it's an educational process as well as it is therapy.
Yeah.
And then after post-op, it becomes the contouring. Then it becomes more of the beauty enhancement.
That was when I was going. So after cosmetic surgery and after you post-op care, what are the things that you think what body contouring methods you think can assess? Because people get surgery. For example, I had clients that they get a tummy tuck and a month later they're like, I want to get with therapy. I'm like, I cannot perform with therapy on you.
Yep.
Like not right now. Maybe let's wait at least 6, 9 a year, depending on what you got done, depending
Especially
on your
for you.
recovery.
I'm sorry, you're tiny, but you're mighty. Like you're strong.
It was a lot. It was a lot. And a lot of doctors, they don't approve or they don't know about either non-invasive body contouring or post-op care. What are your thoughts on that? Like, do you think doctors are getting better at educating their clients regarding the importance of post-op care or body contouring after cosmetic surgery?
I feel like doctors themselves are getting better at being educated too. Okay. And I can say this because I had a local surgeon, good surgeon, but when like post-op was starting to become a little bit more mindful during the pandemic, because that's when I got my big break.
We all did.
Right?
Yeah.
Well, in different ways. That's when I got busy because I would actually go to people's homes because they were traveling for their surgeries. And so when we were closed for being non-essential, I was still able to provide help. I know, no, don't ever, non-essential, pivot. Nobody wants to hear that word. Those are dirty words anyway. But I think doctors are doing better at even finding it, because I had a surgeon that he would not want me to work on people if they were less than 30 days post-op because he didn't want the body to drain liquid too fast. And for me, I'm like, but you're putting in liters of chemical liquid into the body. I'm not Dracula and I'm draining.
It just makes your recovery so much harder. Because when you go to, like, for example, in Mexico or Colombia, you get surgery, let's say Monday. You're getting your first post-op
Tuesday, if not Monday evening, if you're in a facility.
And they will do lymphatic drainage for a bit, very little, very light, super light. And then ultrasound, and they will drain you. And that, I swear, it does make you feel way better. Like, I see it on my client's face. They go like,
right, that physical body, because you're decompressing them. You have to think, when we let the air out of a balloon, how much more lax that balloon is, but also how loose that balloon is afterwards. But for doctors, so 30 days, couldn't touch them. Now, because I've known the surgeon for 4 years, going on 5.
Is a lot.
It's a lot. But now he's become so enamored with it that he now has both of them now have post-op care technicians in their facilities. And one thing I would love for them to do, please, is since you have them in your office, please, is actually include at least a few, please, in the surgical pricing, please. Right. Because what you're doing is you're not only allowing the results to come together faster for your client
will be happier.
And they won't remember the fact that you literally decided to pull a Michael Myers on them and butcher them to death. They're not going to remember the pain. They're going to remember the pleasantry. Yeah. And they're going to be like, this doctor cared enough about my total experience that he ensured that I also was as comfortable as possible, because sometimes it's just going to be uncomfortable.
I'm going to tell you a horror story now that you're saying that. I have a few, but one, I shared one a couple months ago. One time we are in the med spa and this lady came and she's like, I just got a liposuction and I want you guys to do with therapy. I'm like, when do you receive when was your cosmetic surgery? She's like, a week ago. But I said, well, we cannot do that. We can do some ultrasound, lymphatic. Let's see how you're doing. She removes her faja. She's completely like, she still purple. Not even like greenish, the bruises.
Yeah, like the bruising cycle. Oh my goodness.
Yeah. And I say, why has it been a week? Like you're so purple. Like I'm trying to see why this is not turning a different color.
Right. Do you have a hard time with bruising?
Yeah.
Like, tell me.
And she's like, well, at my doctor's office, they gave me a roller pin. And I was like,
Por la pan?
yeah.
Oh my God.
Yeah.
I've heard that too.
And she's like, and my husband is doing my roller pin. And Anel and I were just like, what are you? Like I said,
that's more common than you think.
First of all, I said, roller pin is just to like do your breath. Okay, that's good. Not for your body. Even though, let's pretend you know some therapy technique, this is not the right time for you. She was completely bruised because her husband was massaging her based on not the doctor, a technician at her doctor's office said, just go like this. I say, this will not help you because wood therapy is meant to break down fat cells. And at this point, what we want is we want to heal you.
Yeah.
We want to help you with your inflammation, with your recovery process. And this is why we do ultrasound. It's a micro massage to improve circulation, to
using sound waves to help with inflammatory response and even then to help your circulatory system not focus too much on one aspect or another because our bodies are very monolithic, a survival of the fittest. If you have sorry. I just was thinking of the rolling pin and the fact that I was at Target the other day and there's wood therapy tools in their $5 section, like the cubal roller. Yeah, but it's the one with the little...
I saw that the other day, and since she brought that up, let me tell you guys. I mean, you are welcome to do your wood therapy at home. Now there's a lot of
Do
videos.
your education, please, though.
But when we do body contouring techniques, the movements are meant... There's a specific reason why we do a specific movement. And this is why you go to a professional, because they will know a little bit more if you are a good candidate for wood therapy. Based on your cellulite, what is the amount of pressure? I mean, different factors.
And I'm sorry, there's also body mechanics. You standing up, doing cavitation, wood therapy, your body is already going to be pushing against those. Most of the time it's because you want to do fat tissue reduction. It's going to be pushing against that. So you're not even getting the opportunity to have that focus treatment because your body is trying to keep you standing up.
People ask me, for example, do you do your own ice therapy? I'm like, I can't do it. Like holding my eyes and icing myself, I don't do the proper pressure. Going through the cold feeling, so I'm not draining properly. So I'm like, I mean, technically you can, but that doesn't mean
I'm not going to get the best, fullest results. And for me, I have an inflammatory response after ice. So I can't imagine me trying to muscle through that and then dealing with extra swelling on top of that because I'm sitting there and I'm just like, oh my God, I'm doing this thing and it sucks. Versus I'm laying down on a nice, massage bed and someone's taking care of me. I don't have to think about it. Because isn't that also
I just
part
think
of it?
I'm warm.
But that's also too, you're investing in your self-care beyond this process. But even like for clients, you want to make sure that it all fits.
Yeah.
And surgeons, you also, for a lot of the surgeons, I've been really lucky to have gained their trust over the years and refer clients to me. I don't have any relationships in that regards. I don't get any like kickbacks. I don't get any fees from them or whatnot. I just get their trust, which is priceless to me.
Right.
Because Utah's really good at when somebody knows it, they take it and then they try to do it. And there's plenty of people for everybody. But at the end of the day, my thing is there's only one thing that we really need to have in common, and that is caring for the patient. Because they're a patient first and then they're clients. And I'm sorry, in the beauty industry, the number one thing is you can't diagnose anything. So do you even know what that means to be a patient care provider? I'm glad you understand what it means to do beauty, contouring, body and whatnot, but there are steps and processes that that person deserves to have laid out to them so that way they know. And this is sadly the case. They know if it's did this happen due to my body? Was it due to the surgical process, or was it due to my body contouring specialist? There's not too much introduced too soon. And with surgeons, what I'm grateful for, the ones that do trust me and do refer to me, is we have an open communication as well. And I tell them, hey, this is what I do, because they know other body contouring specialists. They know other post-op specialists, especially like Latin community post-op specialists, Colombianas, all of that. They know other people because everybody's the professional. Everybody's the guru. And I said, from my background, this is what I have seen and this is what I do. This mic's going to hate me. But this is what I do.
And I know you're like super passionate about it. I mean, we know each other for over a decade almost. And I know you're very passionate. What makes you like specialize on post-op care? Is that the need? You saw the need on the market, especially here in Utah, because you're located here.
Mine is the experience. And this is where I get to be a little sentimental. Having worked in home health and hospice, and I was seeing patients that were quadriplegics. I was seeing in stage people that were about to pass on, and I saw the effect on their family members. I saw people who just need a little bit of help after, like, orthopedic surgery is huge too, because we have an aging population. It's very big because Utah's a very big family place. People are born here and they die here. But mine was working in corporate medical and just seeing how, and then thrown to the wolves. And that's corporate. That is people who are coming to see you that have insurances and whatnot. Home health and hospice in some cases, very private pay too. And then seeing that same mentality once I crossed the bridge into the beauty surgical side of things with cosmetic surgeries, I was like, no, this is the one thing I would like to be able to have some say and some control over, because at the end of the day, it is very vulnerable. I don't care if you are getting something as simple, and I use that word very loosely because it's not simple. Lipo is horrible. But if in your mind it's so simple as lipo to as grandiose as a full reconstructed surgery, and you were somebody who got the sleeves, like bariatric surgery is a stepping stool for some people. And that's a whole nother community that I've been blessed to get kind of tripped into. But it's also, you are doing your due diligence as the patient. Why not have somebody meet you there? And help you heal, grow, and glow through the rest of that process.
And stay healthy, because at the end of the day, Tanisha, if something goes wrong, it's our body and we just have one.
We only have one. And then two, your health is going to be different than mine. And that's like, that is a huge thing that people, like I said, I'm really lucky to be working with some very wonderful surgeons that are listening.
And I love to see how you have grown, because I remember when I met you, it wasn't easy.
No.
I remember you went through challenges and struggles that I'm pretty sure.
Self-inflicted.
I'm pretty sure that some people, if they went through that, people will be like, okay, I'm done. But I do remember that you went through some challenges. I mean, how did you pass that to still be here?
I think that also itself is a part of my own healing. Like, because you're a business owner, those challenges in a lot of cases, especially with something that is so personal, like a business is just having another child. It is your baby, but it is your baby that you are growing and hoping that will help to provide a quality of a lifestyle or some luxury in your own. But I think even in that, I am still healing in it, because I'm still discovering myself and my background, my abilities. I'm learning how to manage a business it's a business. I'm in the business of helping other have the better quality of life. But in turn, I've let my own go down. So I think for me, it's truthfully, I'm still learning that. I don't have a direct answer to that, because I didn't take the time to make it a priority. So they say those that cannot do teach. I'll tell you all day and night, take care of yourself, go relax, go do this, don't go back to work fast after surgery. Breast reduction with Dr. Crombie. I was back to work, I think 2 or 3 weeks. And no, it was, but no, I'm still there. Getting past those challenges, I think, is knowing also too why you're in business, because I lost sight of that for a little bit. I started getting into what I think a lot of people, especially body contours, get, is that I want to get that hustle mode. I want to get that money. I want to be the next viral. I want that 1.2 million likes. I want to be famous. I started feeling that FOMO, and I had to stop and take a step back and be like, why am I in this business?
Yeah.
What is the purpose of it?
And I think everyone that I know in the beauty industry, at some point, we started because we wanted to help others to feel better. That happened with me. I lost 45 pounds with ice therapy. And then I was like, this is something that I had to be shared. Like, I shouldn't be keeping this to myself, because we struggle emotionally, women, with when we don't feel ourselves. And you were talking about, body contouring specialists, and sometimes how we are like, okay, I need to get there. Like, what will be the advice that you can give? I mean, you've been in this industry for over a decade. What will be the advice that you will give to... I know, time flies.
Yeah,
I've been doing
9 years.
Body contouring for over 14 this year.
Jeez.
What is a good advice that you will pass on, if you can pass on an advice to someone that is already a body contouring or wants to join this body contouring journey? Like, what do you think will be a good advice for those who are starting?
Know your finish too. Like, know where you want to start. Take the time to plan. Because if you can take the time to plan, then you'll know what to prepare for. And there are going to be wild cards. There are going to be situations nobody planned for a pandemic, at least on our level. You know, like there's going to be things that are going to happen that may deviate a little bit from your plan. But if you know your foundations, your whys, your fundamentals, and then two, what you want your exit strategy to be. Yeah. Because a lot of people, they're leaving because they're tired. They're moving away from their passions because it's no longer that anymore. It's now become a weight. And that to me is heartbreaking, because we started off because we want to help people. Yeah. And now it's like, we want to be done because we're done. We're over it. So if you want to go into this world of entrepreneurship, specifically body contouring specialist, because it's very cutthroat, because it's the up and up. We're about to go into a whole season of people who had this weight loss through medication that has always been around through endocrinology, so like hormone specialties and things like that.
Now there's a lot of injections and
a lot of injections that help with weight loss. Now you're going to be dealing with loose skin. So if you want to be a body contouring specialist, have a plan and have a niche. Yeah. You don't have to be the same person, and make a community. Like, if you can find other body contouring specialists, but that you guys are maybe not similar, but parallel, to be like, hey, Anya, this is not my wheelhouse. Yeah. Can you take this client and recycle that, but also build a community, so that way that client's like, hey, Isha didn't really know what to do with me, but she referred me to Anya, and I love that. That's another thing. Build your community. Yeah. Trust in your goals, but plan that. Those are huge. You have to plan. If you don't plan, you won't prosper. You don't prosper, you'll go out of business.
Definitely. And being, like you said, being an entrepreneur, having your own business, it's hard.
It is.
But I think all of us being there, there's those days that you're just like,
I left a 9 to 5 for this. I put down a consistent paycheck for this. Because even another thing too, hey, by the way, I don't care if you're a solo specialist or if you decide that you're going to open a spa, there's not always an opportunity where you're going to, when you walk in, you're going to leave with a paycheck. That's not always the reality. It's just not.
I mean, when you have your own business, it will just take a while, and you have to be patient
and willing to work. Yeah, like, put in the work with the patience. But if you already know where you want to be, like at the end of it, because we're not going to be on this earth forever. I don't plan on it. I don't know if I want to either, but I don't plan on it, then I have to know, okay, when am I going to step out of the room? Because I don't think I'll ever not be Isha. I'll never not have Ishas in any aspect. But when do I step out of the room completely, but give back to the community education? Or and not even just educating patients. Eventually, I would love to be able to be a consultant for surgeons. Hey, this is what I've noticed. This is the feedback I've gotten from patients that I've seen consistently from you. I think this would just behoove you and your company or your scrub team or this to maybe just keep an eye on this more. But you have to know what you want to do in order to do it.
And the future of body contouring and post-op, I think, is just going to keep growing.
It's just started.
It just started. Yeah. States are trying to figure out some laws and some regulations. because there has been a lot of drama behind it.
And misinformation. And huge misinformation for both the regulators. And it's because in a lot of cases, they have people that are self-serving, providing information to them. Culturally, this is a culture. Yeah. Body contouring stems from the culture.
I know it's been in Mexico since forever, since I was
Latin America. That is a part of it. Yeah. And now we're finding too in like East Asian countries as well. So it's like, okay, but even in that, how do we make it make sense so that way the next quick buck person comes along?
Where do you see it in 5 years? Like,
I actually see it becoming a part of the new norm, because a lot of people too are looking for like holistic ways to achieve their goals. But also,
I mean, even if you get surgery, you still need that post-op care, that body contouring that will help you.
The routine,
get there.
The general routine of self-care. I think, sadly, the pandemic made people have to sit and look at what self-care is for them. And some people did. That's why we do have like all these influencers in health and beauty. Some people took that time to grow, and some people took that time to victimize. And so when everybody came out of that, per usual, as a society, we became monolithic. It was either all or nothing, and we're still missing the importance of balance in between. And with body contouring, I feel like it's just going to just increase and become more and more, because it's cool, it's hip, it's trendy, and you know how Utah is with trends. You know, we are all about the trends. Yeah. We might be 5 years behind on the trends, but we're still there.
What are the techniques that you think are trending right now on body contouring and post-op?
Wood therapy is huge for body contouring.
Wood therapy is huge. And metal therapy.
So huge. Myotherapy is oh my gosh. Mesoterapia. I've started to see that pop up so much more. The cavitations, because it's anybody
cavitation,
can go.
I think it's great.
Anybody can go online and buy it now, because they're buying it for like facial stuff.
And I want to do a different podcast about those things, like, you know, aesthetic equipment. People take aesthetic equipment like whatever, but aesthetic equipment can be pretty dangerous if you don't know how to use it.
That's the next thing
especially cavitation. Cavitation is one of the ones that I'm always the most worried, just because of the frequency. People don't realize
understand
if
the
you have
strength of
a
it.
pacemaker, or if you have metal in your body, or if you're using your cavitator
Stents.
on the bones. Or
anybody has any stents or any neurological disease or stuff like that. And
some clients, they'll be like, I got a cavitation machine on Amazon,
eBay, Alibaba. And you're just like...
And then they ask me like, frequencies. I'm like, I don't know your machine. I don't know what you're doing. Like, I don't recommend. And I feel like people think we don't like it because we want them to come with us. But it's not that. It's just like, if you don't understand the frequencies or the do's and don'ts, why will you put something in your body that you don't understand?
And why would you be so comfortable cutting corners on it and potentially causing danger?
Yeah.
Like, I have clients, celebrity clients, that they can't always bring me out. And so I will guide them through processes because they have the financials, and they will make these mini spas in their homes. But I write out their protocols, and I'm like, hey, this is what you should really be doing. Even they push it. So I'm just like, I'm done. I'm no longer attached with you. And
like, I'm excited about getting some regulations. I know some people, they maybe don't want the state to regulate it, because once it's regulated, everyone has to follow some very specific steps. But it's just for the good of everyone, and just making sure everyone is safe, and just creating the right safe protocols for our clients and also ourselves.
And that's where it's like, that's where you're already so different than a lot of things, because I've noticed, especially where a lot of the beauty schools in Utah are not owned by beauty providers or technicians, that regulations can be seen as a little bit concerning through the community of beauty, because the people that are vying for regulations, it's, once again, it's self-serving. They want to cut corners, create lucrative income for them and themselves, and then provide false promises for these new waves of estheticians that they are going to immediately come out of school and make thousands of dollars if they pick up this technique, that technique, blah, blah, blah. But my concern is, as I hope, as we get into this new season of laws and whatnot, that our overall government, who is the epitome of beauty ignorance in Utah outside of injectables and cosmetic surgery are willing to listen to those who have been in this either culturally, medicinally, or as a technician for long stints and can prove case studies that this is why regulations are going to be helpful. It's going to cut down on injuries, which, Doppel, so many people are like,
I heard they're looking into either certification or vocation.
but we
don't
can
know
have
yet.
that. But if we don't have the people in the offices to help with that, because we have a team we have the government entities, we have Oppler and Doppel that are overworked,
Oppler.
underpaid, and undereducated.
So last year, Oppler came into my office and we talked about body contouring and post-op care. And I told them, I don't want to talk about post-op care right now. Like, I want to talk first about body contouring because it's an issue not only in the state of Utah, but in different states. In California,
And it's a wild card. It's such a wild card.
It is. But I was told just like a month ago that they are looking into certification or vocation. I said, whatever it is, it just have to happen because it's just this is growing and we are getting this by demand.
Right now, there are about 5 micro licensures on the table in the beauty industry that are facing Capitol Hill. And that for this year, I definitely want to do my diligence because I want to be more educated so I can educate my clients. They may not see me, they may not choose me, but if they can say, you know what, once again, this girl, I talked to her, she put me in the right direction, so I'm safe. That's what matters. But there are 5 micro licensing, which includes body contouring, but also like massage assistants and things like that. And unfortunately, Utah has lots of hiccups and issues in other areas that with these micro licenses.
I'm going to have to invite Senator Luz.
Right? But it's like
to talk about this stuff.
But in micro licensing, though, now it's going to provide access to people who want that. I feel like there's a lot more out there that want good for people than not. But once again, we're dealing with an economic fear. And so if it comes to the quick buck, people are going to jump on that first and then look into things later. So once we get past January and probably into March and see exactly what becomes a law locally, that's when I can know myself how to maneuver.
Yeah, no, definitely. And I don't know if it will happen this year, but it's definitely on the table right now. And they're trying to figure out what will be the next step because they know there is like literally no way to stop them. So you are located in
Cottonwood Heights, just right off of 70th South or Fort Union Boulevard.
How can we find you like on your social media?
At Isha Recovery and Sculpt, that is it. Or at Auntie Isha. It's new. It's Auntie Isha's 100% education and humor. Don't look at Auntie Isha for being anything more than your funny auntie that's going to tell you the truth whether you like it or not.
So recommending clients to maybe talk to you, get a consultation before cosmetic surgery.
And don't be afraid to invite their care team at home. So like significant others, children, whoever's going to be around them, don't be afraid to have them as a part of the conversation.
Okay. And so consultation prior, just to make sure, they're going to be on the same page.
Yep.
Do you provide any resources, tools to help the client educate? Extra recommendations, additional recommendations, fajas,
I have
supplements.
A little bit of a booklet that I'm finishing up. Yay, ADHD brain. But I do have a little bit of a booklet, which is pretty much going to be an easily accessible PDF standard. Okay. So you can download it, pre-op questions to ask your surgeon, things to look for in
That's important. Because sometimes we don't know what to ask.
Well, you're standing there naked in a robe and you're bearing your bits that you're not exactly excited for to this person that's going to grab, lift, drop, bounce, move. And the last thing you're thinking about is, I probably should have asked him how this is going to affect Miss Katie down there. Like nobody's thinking about that. But I do have an Amazon specific list because I'm sorry, ease of access. Last thing you need to do is worrying about driving down to Walmart for this, and this.
I've been thinking years of creating a puzzle box with all the things that you need. And
it's even then, that is, okay, how much of that person, based off their healing factor, how much of that are you really going to need?
Yeah. I have it write it down based on surgery. What will be the things that you need? And then those things have to be divided in weeks based on pain,
That's what
surgery,
my Amazon mini list is like. If you're having a mommy makeover with this, if you're having a tummy tuck, which is blah, 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 this, because
believe me, when you're feeling that way, you're willing to buy like whatever. I was like, I'll buy whatever
that makes me feel better. Because I don't feel good right now. And this wasn't part of the I got this surgery so I could feel good. But they don't tell you in those photos that
they don't.
Brittany was crying for the first 2 weeks of that post-surgical because she got 2 liters of liposuction taken out of her hips that make her feel like her skin is burning from the inside out.
And this is here in the States, but if they get surgery overseas.
International, it's a very different process too, because that's
because they're more invasive.
They are very invasive, but I feel like for their invasiveness, I also feel like they are prepared.
Yeah.
And that's where a lot of, because you get cultures, cultures are beautiful, but they're also can be crazy. And the surgical culture, some of the most ugliest personalities have been in beauty cosmetics that I've met. And it's my way or the highway. You went overseas. You went to Mexico. Oh, you idiot. That's why you got your disease or whatever. It's not because of the fact that maybe she didn't take care of herself. She didn't know how to take care of herself. Because I know people in the state of Utah who have actually caused necrosis skin.
Yeah.
And these are board certified surgical people that, are supposed to be the creme de la creme. Things are going to happen. Surgery is a risk.
It's serious, guys. Take it serious.
Please, no, seriously. Please take it serious, because at the end of the day, it's like you said, we only have one body, and you deserve to evolve to that self that you want to be. You deserve that happiness. Everyone talks about self-care, joy, blah, blah, blah. Then be real about it.
Yeah.
Invest in the consultations. Invest in your post-op, whether that is a technician or things at home, because there's lots of gurus out there. I have people that slide into my DMs that I never see for post-surgery, but they're like, hey, I just feel like I can trust you. I'm like, good. I'm glad I gave you that. Yeah. Because that's the impression I want you to have.
I give you that vibe.
That's what I want. But what you decide to do from this information is on you.
Yeah.
Because now we're getting a lot of patients from Idaho, from Las Vegas. It used to be the other way. People are going outside of Utah to find other, and they're still happening. Yeah. But let's stop vilifying and witch hunting certain things in the cosmetic surgery center, and let's start actually showing what true unity can do for it. So there's my TED Talk.
Well, before we wrap this up, I want to ask you 5 fun questions. Let's see if you can answer
No pressure.
them.
Let me sit up.
Okay, no pressure. If you could use one body contouring tool or technique for the rest of your career, what will it be and why?
I would use Sculpt Ice because I love it. No, sincerely, I would use Sculpt Ice.
Don't say it because I'm here.
No. In fact, there's so many times I want to shake and be like, Anya, no, I need this now. No. But no, I would honestly say I'll use a frozen herbal lotion, because someone who understands skin integrity and how it also affects positively the neuro reboot that we all need, because we're in a society that literally just breeds stress. So everybody's running and at high adrenals and cortisols. And it's just it's a really relaxing therapy. It gives people
I didn't pay her to say that.
No. That's why I said herbal ice therapy, so it's completely distant. But no, sincerely, it really is a really relaxing therapy, because
it is.
The transparency, when I was approached to do I laughed. I laughed. I said, there is no way. I just had a baby. I'm an esthetician student. Everybody's out to get as much money as they can out of us stupid students. There is no way in God's green earth that I'm going to be dealing with that. But once I took a step back and took my medical brain into it, which is like healing and whatnot, I was like,
it's just great.
Oh, this girl's onto something.
Ice therapy is just great.
I
love it. And wood therapy as well is definitely one of my favorites.
If you can trust an ice cube facial beauty thing, you can trust ice therapy for your body.
Yeah.
Sorry. Definitely. You're right there close to your brain. You can trust it for your gut and your butt, Bertha. Okay? Sorry.
It's really good. There's so many benefits on that technique. Okay, what is the funniest thing a client had ever said during a treatment?
Any treatment? Or are you saying what I mentioned?
Anything.
and I have to say this serious because, the funniest thing I've ever had a client, and this is when she was in her patient era. She had just had her mommy makeover. And I love that she was a spicy baby. But the funniest thing she ever said is, so when I'm done healing, what position should my husband put me in afterwards? And I'm like, I'm a pod dog. Me?
You're like, I don't know.
So probably in a reclined position, so that way, because you did have a tummy. No.
Sometimes husbands are excited to try what they pay for.
But the women on the other end, and God bless them, because I am so happy and proud of a woman who knows exactly what she wants when it comes to happy hour. Okay, but I was just like, well, you probably just want to just take it slow once and I'm also glad that I'm a darker skin tone because I know I was red. But that was the funniest question I've ever been asked.
I had a client one time. She's like, my husband wants to when are you gonna be ready for me? And I'm like, well, he paid for it, so he wants to use it. She's like, I just don't feel like doing anything right now. I'm like,
I'd like to keep the podcast a general audience because moms might be listening to this in the car. But there have been so many questions I've been asked, and maybe that'll be something I'll talk about on the auntie page. But that one.
If you could contour a body of any celebrity, who will it be? And what will you recommend for them? I do have one that I want to contour.
You go first then, because I need to think.
You know what? Glamzilla, I don't know if you guys know Glamzilla. She does makeup, and she lost over 200 pounds. She basically just got a mommy makeover literally last week. And she's been posting about her recovery. And I'm like, I want to work on you so bad. Maybe in a year, do some ice therapy for her skin because she has gone through this journey of losing all this weight. So definitely right now, I think I'll do Glamzilla. Like I'll be like, let me work on you.
Oh my God, that didn't help. Okay, so if I had to choose a celebrity, I honestly would probably, oh my gosh, this is so hard. Tabitha Brown.
Okay.
And the reason why is because Tabitha already has the fundamentals of health and self-care. She's really into that, and she knows what her body needs, and she's already doing the at-home kind of wood therapy stuff. Her and Tracy Ellis Ross.
Okay.
She was talking about like wood therapy, and she was doing the cupping for the inner thighs and things like that. But definitely I would say Tabitha Brown, because she is not only someone I look at is like, when I look at Tabitha Brown, I'm like, okay, you could be my aunt. And that's just because our vibes are there. You're into health and wellness. You're not an elitist of it. So I'd love to be able to treat you.
Yeah.
Which you could have anybody treat you, but I would love to be able to lay her down and be like, okay, I'm glad that you did this. Let's get in a little bit more. Let's see how your lymphatic system is working, because you're eating what you need to, you're moving how you need to, but what is your lymphatic doing? Is already there. She's the perfect client because she already has the routine. I love those
clients, the ones that their mindset are already on, this is what I want.
They have the routines and the lifestyles, and they're not afraid to invest in themselves. And we're not just saying that because we want you to spend money on us. They are not afraid to invest in themselves. Like, stop it. Stop hurting yourself. And that doesn't have to be a body technique. Buy the lipstick.
Yeah.
Get the purse that's going to last you for 10 years because it does make you feel good. Put on the makeup before the board meeting, not because you don't, you're worried what Chad at the end of the table is going to say, but because you are a boss baddie that can make executive decisions. You want to go to McDonald's today? Go to McDonald's. Like, just live, breathe your authenticity. But Tabitha Brown all day, every day.
One day, maybe, why not? Dreaming is free.
I can't think like that, Anya. I have ADHD, woman. Do you know what that does?
Maybe send a DM. I will send a DM to Glamzilla. I'll be like, hey, you just got your mommy makeover. Call me.
Hi, boo, hey.
Call me. So I love her. She's on that mindset, and she's taking care of herself, and it's pretty awesome. Well, thank you so much for coming all the way here. She drove 45 minutes to come all the way here. We're going to be posting this. And if you guys know anyone that wants to learn about body contouring, post-op care, or if you are a client that are looking into getting surgery and you want to know what are the proper steps before you go into surgery, or if you already went into surgery and you're going through this process and not feeling great, you can contact Isha. I'm going to leave her information. Thank you so much for being here with me. I really appreciate it.
I'm happy to be here. Best of luck to everybody on their total body wellness journey.
Thank you, guys. See you next episode. Bye.
Bye.
Bye.